Okay, so before entering, I would check the physician orders and the lab results, and I would check the door to see if there is any precautions I need to be informed on, such as personal protective equipment or personal protective clothing that I have to don before entering.
Come in.
Hi Grace, I'm Brittany. I'll be your nurse today.
Hi Brittany.
I'm just going to provide privacy here. Watch in. How are you doing?
Okay.
Okay. Can you state your name and date of birth for me?
Grace Nicole Warner, April 1st, 1999.
Awesome. So I just verified that her wristband matches what she verbalized. Okay, so then can you tell me what seems to be your problem today?
I've got a bad headache.
Bad headache, okay. When did it first start?
3 hours ago-ish.
Okay. Do you usually have them? Like, how frequent are they?
Every couple weeks or
Every
so.
couple weeks. Okay, and what seems to make it better?
Sleeping.
Sleeping, and what seems to make it worse?
Light.
Light.
Activity.
Okay. Are you taking any medications for it?
Ibuprofen.
Ibuprofen. Does it radiate anywhere, or is it like?
Sometimes it moves like down my neck, but
Okay.
it usually stays up.
Okay. And how would you just describe the pain?
Sometimes it's really sharp, and other times it's just like a dull constant.
Okay, sounds good. So then, upon asking these questions, I have noticed that our patient, his face and position is appropriate with her responses towards me, and then I note her alertness and orientation, and then I note her skin color is it's normal tones with pink undertones, and I note her responding and speech are both normal, and then I note her hygiene is there is no odor, and then position and face. So we did that, and I believe that's all for our skin, our general appearance. Okay, and so now we are going to go into vital signs. Could you state your pain on a scale of 1 to 10 for me?
About a 5.
Of 5. Okay. Sorry. Do temperature first.
Mhm.
I'm gonna put this in a hot. Okay. And this is 98.8, which is good. And then we're going to do your apical pulse. And I'm going to listen for a full minute, okay?
Okay.
Okay, so I just listened for a full minute, and her apical pulse is a 63, which is normal, and then her respirations was a 14, which is also normal. Okay, and then we're going to do your blood pressure.
Okay.
Can you also state my name?
Brittany.
Okay, and can you also state where we are?
The hospital.
Okay, and can you also state what time of day it is?
Good afternoon.
Okay, and so I'd also note that on her general appearance, or general assessment. That she is orientated with person, place, and time. Lay your arm down. Just gonna move this right here. That's okay? And hold it. Sure. You. And I'm just gonna feel manually with my fingers. I'm just gonna listen with my thermometer.
Okay.
Or my stethoscope, sorry. Okay, and her blood pressure was 112 over 78, which is normal. Thank you. Okay, and now we're just going to touch your pocket sauce symmetry. Okay, 98, which is normal. And then we're going to go into your neuro assessment. Okay, so I would check on the Glasgow Coma Scale. So our patient has responded verbally and has good responses with that, and her eye movement, which is good and focuses on me. And then I also noticed her body movement, which is also very good. So she has a good rating on her Glasgow Coma Scale. And then we are going to test your eyes. Okay. So I'm going to test your pupil size, okay? I would say they are 4 millimeters on the pupil gauge, and then I'm just going to have some bright light, okay? Okay. So as I shine the light in her left eye, both eyes constrict, and the same for the right. Okay, next I'm going to have the patient sit up, and I'm going to have you take a swallow.
Okay.
Okay, so I notice that the patient can swallow fine and properly, and you can lay back down. And then I haven't noticed any facial droop. And now we're going to do your strength test.
Okay.
So I want you to squeeze my fingers, okay? Good. And now I'm going to have your fingers go up and down, so like this would be down and this would be up.
Okay.
And I'm going to have your eyes closed, okay?
Okay. Down. Up. Down. Up.
Okay. And I'm just going to do the same with your feet, okay?
Okay. Down. Up. Up. Down.
Good. And now we are just going to test your strengths, okay? So you have your arms like this, and I'm going to put resistance on them, and you're going to pull towards yourself, okay?
Okay.
Good. And push away. Good. And then I'm going to have you do the same with your feet. Once you push down on the gas and lift up. Good. And have your legs lift up. Good. And now with that, we're going to go into your respiratory, okay?
Okay.
So I would note that the patient is not having any labored breathing, and if she was, we would use try to get the use of an incentive spirometer and teach her about deep breathing. And then, are you having any cough or mucus?
No.
No? Okay, so that's good. If she was having any cough or mucus, then you'd request a sputum sample, And with the sputum sample, we would check the amount and color to make sure everything is normal. Okay, can I have you sit up on the end of the bed for me?
Absolutely.
Thank you. And I'm just going to listen to your lungs, okay? And then I'm just going to lift underneath your shirt and listen. Okay. And then I'm just going to listen to your back. Just going to lift your shirt up, okay? Okay, thank you. And I can have you lay back down.
Okay.
So I listened to her lungs in 6 spots on the anterior side and 8 spots on her posterior side, and there was no abnormalities such as cracking or wheezing, which is good. And then we would move into your cardio, okay?
Okay.
So with that, I would check the IV rate and make sure that it is the proper amount and right into the and it's not causing any harm on her body. Okay, so I'm just going to listen to your heart here.
Okay.
Okay, and I'm just going to listen with the bell, okay? Okay, and your heart sounded very good. And when I was listening, I listened to the aortic and the pulmonic. And the aortic and the pulmonic, the S2 was louder than the S1. And then I listened to Erb's point, which the S1 and S2 were equally as loud. And then I listened to the pulmonic, or the tricuspid and the mitral valves, and the S1 was louder than the S2. And then we're going to test your capillary refills.
Okay.
On your fingers. And I make sure that the patient doesn't have any nail polish on it. And they return almost immediately. You want them under 3 seconds. Do the same for your toes. Okay, and those had good capillary refill. And then I'm going to check for edema in you. So I'm going to see your legs. And do your ankles. your feet. No signs of edema, which is good. And then I would go into your skin assessment, okay? So with skin assessment, back that up. In the cardio, I would also do her pulses. Okay. And so I'm gonna do your radial pulses here. Good, and do your tibial pulses. And your biggest pulses. And those all have a 2+ on your on the rating scale, which is good and normal. And then after the cardio, we would go into your skin assessment. So with the skin assessment, I would check the Braden scale to make sure that you are not at risk for skin breakdown. And I would check for any lesions or skin breakdown that you were having. And I have not noticed any. Have you noticed any at all?
Nope.
Okay, sounds good. And then I'd want to make sure that my patient is on a turning schedule, so she's not at risk for skin breakdown. And we want to get you up and mobilized. Okay. And then with skin, I would also want to check your skin temperature. Okay. And then I also want to note skin color, which is normal tones with pink undertones. And you feel warm to touch, which is good. And then I'm just going to touch your, do your skin turgor right underneath your clavicle bone. I'm going to pinch your skin just to see if it retracts right away, okay?
Okay.
And it retracted immediately, so that is very good. Another thing, I believe that is all the skin breakdown. Oh, check the bed. Check the bed to see that if she has a specialized bed to help with her skin integrity. And then the next thing we're going to do is your abdomen assessment.
Okay.
So, have you lift your shirt up here for me? Okay. And then I am just going to note that your stomach is flat. And I'm going to listen in all 4 quadrants, okay?
Okay.
I heard bell sounds at every 4 quadrants, which is very good. And then I'm just going to start with some light palpitations, okay?
Okay.
So you're going to feel me pressing through your stomach a little bit. Tell me if you're feeling any tenderness or discomfort, okay? You still doing okay?
Mm-hmm.
And I'm just going to do a little deeper palpitations, okay?
Okay.
Okay, and then all feels good. And did you notice any tenderness?
Nope.
Okay, good. So patient noticed no tenderness, and then I did not feel any muscle rigidity or any abnormal masses or lumps, which is good.
Great.
And then so I have a few questions about your bowel movements, okay?
Okay.
So when was the last time you had a bowel movement?
This morning.
This morning, okay. And how frequent do you have bowel movements?
daily, every other day.
Okay. And what are your bowel movements like? Are they hard, soft, or runny?
Hard or soft depending on my hydration.
Okay. So they're more hard when you're dehydrated.
Yes.
Okay. And can you state like any discomfort with that
When I'm dehydrated.
when you're dehydrated?
Mhm.
Okay. So it's good to stay hydrated with your
Right.
to help with your passing stool. And then we also want to notice the color of your stool. What color would you say it is?
When I'm dehydrated, it's very dark and light when I'm hydrated.
Okay. And any abnormalities you see with your? Okay, sounds good. And then and you said a little bit of discomfort with the.
Mm-hmm.
Okay, sounds good. And then I would move on into the urinary system. So I have a few questions with that also.
Okay.
With your urinary system, when was your last void or urination?
Earlier this afternoon.
Okay. And was it a lot, a little, average?
Average.
Okay. How frequently do you void?
Like every 6 hours or so.
Okay. And what color would you say that your urine is?
And yellow.
A yellow?
Yeah.
Okay. Like a dark or a light?
In the middle.
Okay. And how would you say if it's like clear or cloudy?
Clear.
Clear? Good. And then, have you noticed any sediment with your urine?
No.
No? Any abnormal odor?
No.
No? Any pain while
No.
urination? Okay. So then I would want to check to see that the patient is not having any retention, and with that I would note to have a bladder scan performed if she needed it. And then after urinary system, we're going to go into your activity level.
Okay.
So how active are you?
Not terribly.
Okay. So how much exercise or mobility are you getting in a day?
I'm up on my feet for probably like 7-8 hours.
Okay. Do you have any limitations?
No.
No? That's good. Do you use any assisted devices?
No.
No? Good. I would note that the patient is not using any TED hose or STDs. And then I note that you are not at high fall risk. And then activity. I want to make sure that she is getting up and more mobile a lot, so she's not having any skin breakdown throughout the day. And I want to note her bed position. And then, do you have any questions for me, Grace?
Nope.
Okay. And so I noticed you have your collar. You know how to use that?
Yep.
Okay, awesome. And is there anything else I can do for you?
I don't think so.
Okay, so I'm just gonna wash out and document.